Traditional healthcare has long operated on a defensive footing. In most systems, a patient only enters the network when they are already ill, and their care is limited by the isolated capabilities of a single clinic or hospital. These systems are frequently paralyzed by their own bureaucracy. When patient data is locked in physical silos, administrative burdens multiply, slowing down diagnoses and creating deep inefficiencies in how care is delivered. Saudi Arabia's Vision 2030 identifies this analog gridlock as a primary obstacle. The kingdom has issued a mandate to move beyond these outdated frameworks, replacing them with integrated technology designed to scale. This creates a unique tension. The kingdom must rapidly expand medical access for a growing population across vast distances, but they must do so while increasing the efficiency of every medical facility in the country. You cannot solve a challenge of this scale simply by building more physical hospitals. The limitations of geography and staffing mean that traditional construction alone cannot meet the demand. The solution requires an invisible digital infrastructure. To meet these goals, Saudi Arabia is building a digital nervous system, a network that connects hospitals, medical professionals, and the patients into a single, coordinated organism. This transformation begins at the micro level, the individual patient. By integrating technology directly into the patient's daily life, the kingdom creates the first foundational points of its healthcare ecosystem. Smart platforms let users schedule appointments, easily manage prescriptions, and view medical information instantly. These tools shift logistics away from the clinic and into a streamlined digital interface. This approach addresses the historical friction of the patient experience. Instead of navigating administrative hurdles, patients use a responsive system, prioritizing their time and access. By creating this digital ease of use, the system encourages greater engagement. Every interaction transforms a passive patient into an active node, providing the high-quality data that powers the broader network. This data flows into the meso layer, where individual patients are linked to medical hubs via expanded electronic health records. Isolated data fragments now snap into a unified health history, letting doctors coordinate diagnoses across facilities. This connection extends via telemedicine, providing remote care to distant areas and bypassing long travel. Geographically, this represents a massive, fundamental shift. Patients in remote areas receive follow-up care and medical advice instantly, which simultaneously reduces the physical pressure and overcrowding at urban clinics. At this network level, digital tools are effectively erasing the limitations of physical geography. The kingdom is proving that a more responsive healthcare environment can exist without the need for a physical waiting room. When millions of these daily digital interactions are funneled together, they form a national data stream. This is the macro level, the scale at which individual data points become national intelligence. To process this volume of information, the kingdom uses artificial intelligence and data analytics. These advanced technologies act as the brain of the system, assisting professionals in making informed, large-scale clinical decisions. By analyzing real-time trends, the system maps potential disease outbreaks before they peak. This allows the government to preemptively allocate resources, moving medical support to exact locations with mathematical precision. The integration of AI shifts a nation's healthcare posture. It moves the system from a state of constant reaction to one where potential health crises are neutralized through data-driven foresight. Saudi Arabia has moved beyond a collection of disconnected clinics to build an interconnected, proactive digital ecosystem. This is a significant leapfrog moment. By investing heavily in these technologies now, the kingdom is bypassing the legacy trial and error that slows down older, more established medical systems. Through this combination of medical expertise and technological innovation, Saudi Arabia is positioning itself as a regional leader in digital healthcare, establishing a high-tech standard for the surrounding area. This system is built to be a sustainable and repeatable model. The kingdom's ongoing investment reflects an ambition to create a system that is efficient at home, but serves as a framework for modernization abroad. The result is a blueprint designed for long-term growth. By proving this digital model works at scale, Saudi Arabia is creating a path that could influence healthcare development across the wider Islamic world.
OIC Today. Leaders of today, leaders of tomorrow.